I am Guillermo Salinas. I'm an interventional cardiologist practicing in the community in the Rio Grande Valley. I've been in the valley for about 13 years, taking care of multiple cardiovascular conditions. And I would like to thank the Rio Grande Valley Diabetes Association and Happy Healthy Valley for the opportunity to speak to the community about COVID-19 and cardiovascular complications of this condition. As we all are aware, COVID-19 pandemic has hit the Rio Grande Valley very hard. COVID-19 affects population from children to adults. But as we all are aware, there are more vulnerable populations to this infection. In the cardiology practice, we treat these patients with comorbidities on a daily basis. And we have seen now with the heavy caseload in the valley of COVID-19 an exacerbation of these comorbidities. As we all are aware, certain comorbidities make you more likely to have a bad outcome from a COVID-19 infection. And these include diabetes and cardiovascular disease. COVID-19 infection is caused by a novel coronavirus. Coronavirus is a group of viruses that have been causing respiratory infections for many years. But this specific coronavirus type was recently discovered and, as we all are aware, hit the United States and the Valley recently. The coronavirus or COVID-19 infection has an average exposure to symptom development of about 5 days. But after exposure, you can develop the infection until up to 14 days after first contact. Patients may be asymptomatic, pre-symptomatic, or symptomatic, and they all have the capability of transmitting the condition. Transmission is still believed to be due to droplets, transmission in face-to-face or by contact with contaminated surfaces. So it is extremely important that we continue to use all the information out there and continue to follow the preventive guidelines by different organizations within the United States. It's extremely important that we continue to keep social distancing as an important technique to prevent the spread, as well as the use of masks. COVID-19 infection can present with very different symptoms. The most common symptoms are fever, cough, and shortness of breath. But there are other symptoms that can also present with this infection. These symptoms may include loss of taste and smell sense, fatigue, sometimes debility or generalized weakness. And these are the usual symptoms that most patients have been complaining during infection with this condition. Now, specifically talking about the cardiovascular complications that we are seeing with COVID-19 infection, it's very important to mention that the classic complications of cardiovascular disease, like acute myocardial infarction, stroke, and congestive heart failure, continue to occur during this COVID-19 pandemic. This is very important to know, especially because patients with these comorbidities are more likely to present also with these symptoms during COVID-19 infection. And it's very important for patients to be aware of this and do not delay care for these conditions because of the fear of coming to the hospital to be taken care of. It's very important to comment that during this COVID-19 pandemic, we have seen how patients are likely to delay coming into the hospital to get care for needed cardiovascular conditions because of this fear of getting a COVID-19 infection while in the hospital. And what this has caused is that we've seen patients with a lot of cardiovascular complications that we didn't see before or in the recent past because of delaying this care. I think the most important message today is COVID-19 is a reality, and we're going to be living with this infection for many months to come. Remember, cardiovascular complications of COVID-19 infection are happening every day. If you are having symptoms, please do not delay care. Go to your hospital of choice and please make sure that you're properly evaluated for any cardiovascular symptoms or complications that may be secondary to COVID-19 or that may be happening in the setting of your current comorbidities at this time. Thank you for the opportunity again to the Rio Grande Valley Diabetes Association and to Happy Healthy Valley to be part of this effort to better educate the community to improve our outcomes here in the Rio Grande Valley.